What do you think of when you hear the words virtual reality? Maybe you think of video games like the Oculus Rift, HTC Vive, or Samsung Gear. But do you ever stop and think about the other ways in which virtual reality is used? The first virtual reality system, the Sensorama, was created in 1960 by Morton Heilig. In 1961, the first model for head-mounted displays, or HMDs, was developed by Philco Corporation. It was known as the HeadSight. Ivan Sutherland brought about the Sword of Damocles in 1966. The Sword of Damocles combined HMDs with computers and motion tracking systems to enable realistic movement around the simulated environment. Finally, in 1987, the title virtual reality was coined by Jaron Lanier. VR systems were not incorporated into medicine until the 1990s, when they were used to simulate surgeries such as colonoscopies and other gastrointestinal procedures. Over the last few decades, VR technology has only continued to advance with the establishment of companies such as Oculus VR. VR systems can be used for pain management in both adults and children for people with all sorts of chronic pain conditions. It has also been used to help those with social phobia by introducing them to phobia-inducing situations within a controlled environment. Social phobia is just one of the many psychological disorders that VR systems have helped to overcome. Others include agoraphobia and PTSD, post-traumatic stress disorder. VR systems can even be used to help improve balance in stroke patients. Lower-cost VR systems such as the Kinect, Wii, and P5 Glove have been tested to evaluate their efficacy in upper limb rehabilitation. Virtual reality systems also have the capability to help train military personnel and surgeons. In addition to training, virtual reality systems can predict the acceleration of skill decay experienced by military surgeons between deployments. Although work can always be done to make VR systems cheaper and more accessible to the public, VR systems are far from scarce and their uses are vast. Now that you know, what will you do with virtual reality?